So the mothers will use the 3 ways of identifying the mother, and that's what will make the effectiveness of this method quite high. We are going to be studying this effectiveness here in Masaka and in Kampala dioceses. And then we have to put the body of evidence that record is available in the US, and hopefully we'll get a language forward. So, like other natural methods, we base on the menstrual cycle. We just have a recap of here. In the menstrual cycle, we have 3 phases. The first phase is where there's menstruation, and then we have a phase which is the fertile window, which is what we seek the cup of blood and identify. And after the second phase, we do the third phase, which is non-fertile, and it's one before the next cycle. So there are 3 phases. The most important phase is the second phase, which couples scanner, and we are going to teach them how to identify, and when they identify that, they can make the productive decisions. And in this market method of natural planning, we usually have special charts which we provide to the mothers who are going to be enrolled in the study. Specifically, we are going to be identifying 200 couples. 200 couples, 50 of which will get effect from Chicago Hospital, 50 from Gamma Hospital, and 50 from Summer Hospital, and another 50 from Rural Hospital. Those are the 4 research sites we are going to have in this study. So these couples will have set a form where we will set the seats of their menstrual cycles, and we will be enrolling these clients, giving them some transport funds so that they can get problems access to health facilities where we are going to have research assistants. Our research assistants are already being trained by the Gate University. We had 2 trainers from Gate University here, recently over the last 2 years, and trained at least 2 health workers from Gate University are being trained and are going to be participating in this study as research assistants. And with this, will be contributing to the family planning aspect of the self management. So this is more information about the difference just been talking about. 98% effective, quite higher than what we have, like the Sunday method that uses the 1 week is 95%. But here we are going to be using a method that is much higher in effectiveness, which is at 98%. So with this, I would like to make our introduction in the interest of time, but in case people need to know more, we are available for questions. And so please be aware of this study and be very supportive of it, because as you know, family planning is one of the healthcare outreaches which we need to offer and we need to strengthen in other things. Thank you very much.
Thank you very much, Dr. Ray and Dr. Henry. We will have nurses from Villa Maria and Bishop. We've already trained to teach this method. Sister, if you are there, please rise for a quick recognition if we have any. Thank you, sister. We get to know this method very well. But before we conclude, we can ask ourselves, where is the theology of natural family planning? What is the connection between natural family planning and the church? We all know that the church subscribes to natural family planning, not other methods. And God who created man and blessed him with good food, did not forget, give man the wisdom to regulate birth control. So we can use the methods. I will encourage each one of us here to spend some time and read this encyclical, The Humanity of 1968 of Paul IV, and the Catechism of the Catholic Church. All the theology is embedded there. We are trying to put in practice what the church teaches. Thank you very much.
Thank you very much. The team Dr. Alex Basomoka, our chief guest, you are possible. Thank you for making it. May I request that we have a presentation from Jay Ellis.
Good afternoon. I hope we are all feeling better now. Today is a special day for me. When I come to Masaka, mambo yangu hujenje. Ndio school wewe na wewe. Leo tuko hapa na Kusumba. So it's a pleasure to spend time with your leadership. All protocol observed. My name is Caroline Naiga Katongole, Chana Masaka. Address me as such. Because I have a Katongole name, some people want to call me Chana Katongole. My father was married to Katongole. Strange. So I went there, I went there with people. Okay, nobody knows. All BWALA students. I bring you warm greetings from the medical store. On a side note, we lost our chairperson of the board, and we are mourning him. So that's why our evening could not make it. But he trusted me to step in his shoes. And if you pray for me, my Lord Bishop, I think I'll be able to do a very good job. This is October, and it's after lunch. We're going to have our faith, those who are not eating. Thank you very much. Let's take our seats. I would like to recognize my Lord Bishop and the entire team here present, all protocol observed. Having told you my name, my background is from the nursing institution. So I'm first a nurse and then somebody else. So my nurse memory. My nurses, yeah, I'm happy to see you, and I want to remind us that we were founded to love and serve. So this morning when my Lord Bishop was closing the Mass, he reminded us to be compassionate. I want to know about nurses and midwives. Let's remember that question. To be compassionate. Let's step into the shoes of the patients. I'm going to have very few words this afternoon. I think 5 minutes will suffice. So during medical store, yes, so Joint Medical Store was founded 45 years ago by the Ghana Catholic Medical Bureau and the Ghana Protestant Medical Bureau, purposely to be the supply chain arm of the church-founded health facilities. And now, 45 years down the road from 1979, we stay focused on the mission. So our vision is quality health solutions accessible to all for the glory of God. Everything we do, we must remember that we stand to glorify God's name. Our mission is to provide value-adding health solutions to accredited health units and other stakeholders. And the accredited health units are you, the facilities that you represent. You are accredited by the Uganda Catholic Medical Bureau. And that's where our sisterhood starts from. The Uganda Episcopal Conference put in place its the health arm, or medical arm, which is UCMB, and it founded Joint Medical School, which is also the one that accredits you. So that's the relationship we have. And our purpose every day is saving lives diligently. Because when you talk about lives, you have to remember it might be my life, your life, or anybody's life. And quickly through today's theme, Christ has come so that we may have life and have it in its fullness. And in that same vein, our services are as listed there. Quickly, we sell medicines, medical equipment, laboratory requirements. We also do warehousing, and that's why we are the chosen partner for USAID to warehouse and distribute all those donor commodities that we receive. Many of you have seen us. I visited Kalungu in May and June, the number of facilities, and I'm happy to see how what the findings we got are similar to what Father Matabazi was presenting. Indeed, Father, the people at the facilities actually do the work. I also sometimes wonder what government of Uganda would do without these facilities. Because when you compare the facilities that the church founded and the others, you see a big difference. So we want to thank you for the diligence. You are always on duty to take care of the patients, and we cannot take that for granted. We are running a risk. Thank you. Laughing? His Lordship is laughing for you. You can proclaim His Lordship. So we did a risk management training, and I wanted to just share something here. When we come to you and we tell you a few matters pertaining to sustainability, you need to remember that what we fear might happen actually can happen. From where I'm standing at Joint Medical School, we suffered a fire in the year 2019. But to tell you the truth, we have never recovered fully from the effect of that fire. We lost over 21 billion, and because we were very, we had sense that since we live in merchandise, we can have a fire, we also receive the insurance. But the insurance teams can never pay you up to 100%. So you can imagine today is 2024 and we are not yet recovered fully. Therefore, please keep in mind the risks that we face. At JMS, we do capacity building. Some of you may want to know, we are not a teaching university, no? But within the healthcare environment, we can give you capacity building, for example, in terms of customer service, in terms of system strengthening, we do that. We do equipment maintenance. When you buy equipment that you use at your facilities, we come to you and maintain it for its full life at no cost. No cost. You will only buy any, what do they call it, spares if they are necessary. But all the man hours and technical abilities come to you free of charge with a lot of love from us. Other innovations are the ones I want to talk about now. Okay, so in the recent past, and hanging also onto the theme, a mission to be embraced in an era of technological advancements. We can no longer do things the way we used to do them. If you work the same way and expect different results, you would not be serious. You cannot get different results unless you work differently. So we come to you with a number of packages. Somebody, I had Chitofu, my sister Stella, is my OG. Sorry for you who wanted to hear a small voice. I'm the second lady who is talking to you. Unfortunately, I have a man's voice. So, please bear with me. Good. So, we have turnkey projects. I heard my sister Stella talking about the need to revamp the OPP. If you have any infrastructure development that you would like to do, we ask you to work with us. We shall draw the plan for you at no cost. Yes, we shall work with you to get because we give it to you at a certain at a level you will, because we shall go through all the approvals. On condition that we shall give us that project to run from beginning to the end, and we give you a key to start working. So we do the design, we will have fundraising platforms. I have a very happy listener here. I will see you after. We fundraise, we have a fundraising platform right now running for North Angola Diocese. They are building they have a very big project. I'm going to show you something. We construct and then we equip and give you the key to start taking care of your patients. These people in Tororo, St. Anthony's Tororo, also chose us to do that. That's the design. I just want to show you that we are really serious. Katumu Specialized Hospital, that's the design, that's work in progress. ETC. We have designed an intensive care unit, and that's also work in progress. I just wanted to show you. Now, this is how the platform looks. If you give us the mandate, we shall ask the population, the public, to support you so that you can get some donors. Quickly, we have a 2-year payment plan. If you've been thinking about acquiring any equipment and you feel your hospital, like sister from Big, and you feel your hospital is not yet ready, doesn't have that amount of money, come to us and we shall give you that equipment. You start using it on a 2-year payment plan. We tell you the cost of the equipment, you pay 30% upfront, and the rest you will pay over 2 years. Now, my last slide, please. My last slide is about our relationship with Masaka Diocesan Medical Services. Masaka Diocesan Medical Services was founded by Masaka Diocese out of so much love for all of you and the people we serve. Under the leadership of the then Bishop of Masaka, with the stewardship of Reverend Father Emma, Masaka Diocesan Medical Services started a medical store here in Masaka. Father Emma used to come to Zambia. I have served there for 22 years. But we calculator. He used to come to my place. I was young, and he was always wondering how people travel such a long distance. They suffer with the jam in Kampala. How I wish God would enable us to start a store. When I look at Father Emma, I see Christ himself passing by. Why? Because he years with a lot of love. And he did all that work behind the curtains. Now, you heard him talking about how much money you are able to purchase and all that. So we worked in partnership during Medical Store and Masaka Diocese, and now Masaka Diocese Medical Services is 11 years old. So, what is my plea? Everything I have talked about as George Medical Store, you will find it at Father Emma's office in Masaka Diocesan Medical Services. When you have a question, please go there and we will be delighted to serve you. The mandate that Masaka Diocesan Medical Services Limited has with you is to serve all health centers that are accredited to UCMB and UPMB within 7 districts, as you can see them over there. I request you to entrust all your needs to him, because we call, and interestingly, I'm now the manager in charge of the outlets, so that's why I'm the one who came here today. So if you have any questions about what I have said, please feel free. I'm still around. Pass me a note, and I will be happy to attend. But thank you very much for your support, and God bless you all.
Madam Carol Masaka, thank you very much. Now we are going to have TPO, then Life. When they told me TPO, the application was different for me, and I said, TPO is true to people organization. So these are the people who are true to us. I hope I'm right.
Thank you very much for giving us a people perception abbreviation. But in full, TPO is also transcultural, psychosocial support organization. I think let me do introduction of myself. I'm called Dennis Nwakawa, those are my names, and I'm the Director of Technical Services, but also the Deputy Chief of Party. I'm here to represent my boss, the Chief of Party, but also to represent the Country Director who couldn't come, but all of them are sending you warm greetings. I think I've jumped the protocols. My Lord Bishop, I want to thank you for giving us the opportunity, and Father Katabas to invite us. I didn't come alone. I came with my colleague, my finance director. I want to request Mr. Kisito. He's our finance director based at the country office. I still want to take this opportunity to say that this project, which where we are supporting Masaka Diocese, the citizen service, health services, is supported by American people. American people can we clap for them. These are taxpayers who perhaps don't even know where Uganda is located on the world map. But because of their love and what the bishop said earlier today, compassion, because they know that the HIV is ravaged in this region. This was the epicenter. And so because of their love, they are supporting people they have never met. But as long as those people receive this support through us and through Masaka Diocese, and it improves their lives, for them they are happy. That's what they are happy. And I equate it to the gospel today where was that Good Samaritan. The Good Samaritan helped somebody he didn't even know. So those are the kind of support we are talking about. TPO started in 1994, just for information, and we are a national NGO whose vision is improving mental health and socio-economic well-being of the people. That is our vision, that's what we want to see. And this project is funded by USAID and PEPFAR, and it is called USAID Keeping Children Healthy and Safe. And TPO is the lead organization, or what they call prime organization. And this project is the biggest of all USAID OVC projects in the country. Currently, we are working in the 28 districts, local governments, of which Masaka region we are supporting Masaka Diocese 6 districts.
Karangaram, Komansibikarungu, and all the others in this region. But we are also supporting 2 cities. This is Masaka City, where we are studying, but also BWALA City, making 30 local government districts that we are supporting. And Father Katawas made me well by going over the details of the project, so I won't go there because he has given us, we are aiming at reducing HIV new infections. We are aiming at making sure that no new infections should happen, because as we were talking today, technology has come, and I think technology can make us not have new infections if we follow the technology and the new information we have, and the medicines, the drugs. I like Dr. Omachi called the drug as part of the technology, and I think that's a very important thing. So, Dr. Rash, thank you very much for that. Because medicines, before the ARVs came, I think members from here, you know what the situation used to be. We are focusing that situation of the old thing. It's not there because of what? The American people working properly for welfare put the medicine which we see that all the ceiling of that time. So, but we have a responsibility. We have to make sure that we adhere to the treatment in order to achieve viral suppression. So, on our side, I think we also need to mobilize. I like Masaka because he raised the issue of the spiritual. I think we need a spiritual support in the area of treatment. Sisters, those students there, we need the area of treatment does not only require the medicine, but it requires your mental and resilience and also spiritual support. If the priests and the sisters tell us and remind us that the medicine, we listen to the church, we shall take our medicine. So we should take advantage of our spiritual enrichment in group adherence treatment. I just want also to emphasize that community health insurance is very important. I think the Labour Parliament who went mentioned about it. I think there is a need to explore how Masaka Diocesan under this very beautiful community health programs can benchmark from existing health programs. And I happen to come from the region where there is disease hospital in the whole country. This is in the Church of Uganda. It's the role model for community health insurance. So I think at some point in time, Father Katawas will need to arrange an exchange visit with maybe some people from here to go and understand how have they sustained community health insurance. Because we already have the infrastructure to make community health insurance work. What we need is to learn from our brothers and sisters in the Kunjiri Kanu, how are they doing it, and Father is really very good at translating knowledge from one area to another. And I think in the future, we shall be celebrating community health insurance and Masaka Diocese in the future. As I move towards the end, last week we were here in this region at Provide Hotel with the district leaders, chief administrative officers, community development officers, probation officers, and in that meeting it was called pause and reflect. And Father Katawas came along to say hi. But the whole point was that we are working with local government to ensure that this work which we are doing, which is time bound, can be owned by the district government, can be put in the district plans and budgets, and we all embrace it for sustainability. My sister from Benjamin Costoras mentioned sustainability. Our theme for the work we are doing is how can it be owned? How can it be continued? And when we see the faith-based leaders, when we see the community representatives, when we see the local government, when we see the other districts with us today, that is the road towards sustainability. Because what we are doing is important, but we also need to work with existing structures on how to see this work continue. As regards the theme of the day, which is the technology, KCHS and TPO believes very strongly in using running. And so, Father needed show perhaps is the data. The data, I think you saw the numbers. That is, without numbers, we cannot make a decision. So we use those numbers, the technology, the computers, the software, to ensure that we collect the data, which is evidence, so that we can base all our decisions on something that has been tested. As I conclude, I want to repeat the message for today, which is compassionate. Let us be compassionate. These numbers, to us, they represent the people, real people. It's not only data, but it is real people. And I also want to take this opportunity to thank the Lord Bishop for hosting us last year when we came for a meeting. And we came with the very big officials from Ministry of Gender, Ministry of Health, and he hosted us. That's the Project Advisory Committee, which gives us advice on how to implement this project. So with those few remarks, I want to thank you so much, and God bless you.
Thank you very much. I understand you made your presentation in a rush. Thank you for compressing the presentation. Given the team is stand up for recognition, Joseph Setagara. Joseph Setagara, we used to know you as part of Masaka, now you are part of BWALA. Mr. Edward Batanda, thank you for coming as a team, getting the team. Our lifelong partner, LifeNet, we are expecting a presentation. LifeNet was supposed to make a presentation of 20 minutes, but he agreed that he's going to make a presentation of 4 minutes, but please you can use 5. Dr. Daniel, from Arugu DHC, Arugu, most welcome.
My Lord Bishop, ladies and gentlemen, protocol observed. My name is Edward Salikamai. I'm the management program team lead at BWALA International. With me is Grace Rishawa, the medical program head. Also a team of senior mentors that take care of our partners in Masaka Diocese, that's Richard and Confidence. LifeNet International started working with Masaka Diocese in 2015, and it's where we started, and we should say it was a very good seed. We've expanded since then. With regional offices in Potro and BWALA now, partnering with 129 facilities. I'll not go into the problem. Our mission as LifeNet is to transform African health facilities to provide quality, sustainable health care and save lives. We do this in 6 African countries so far. Having 410 facility partners with a catchment population of over 12 million. Back in Uganda, we are partnering with 129 facility partners, having trained over 5,000 health workers. This is how we do our work. We do medical training. We also do management training, because we believe that even when you have a very good midwife, but if they are not properly managed, we lose them. So we go into financial management, human resource. We also do training for human. We also do equipment supply, support for our facilities. We do digital enablement, which ties in well with the theme of the day. And this we do through our online platform, where people can log in and access materials and do self-learning. We do M&E and learning. We do quality assessments to inform our program. In Masaka Diocese, we partner with 24 health facilities. I won't go through the name. This is what we've done so far. Distribution of guidelines to 10 sister-led health facilities. We are currently running a fund specifically for sister-led facilities, and in this we've been able to distribute these important IDC materials in the 2 months since July this year. We've been running this fund, and that includes updated essential materials for medical care guidelines, essential medicines and health supplies list, health unit management committee guidelines, and updated immunization schedules. Guidelines are recently partnered with Uganda Water Project, and we've been able to support 7 health facilities with water solutions. So far, 5 have already been completed. That's Kayayo, Koding, Sibocham, and Mama. We are doing a work in progress. I would like to commend the facilities that we work with and the diocese. This project, you have to contribute something, and that is in terms of materials. But when you compute, it's about 20 to 25%. But facilities in this diocese are very responsive. There are places where we find this project, and it stalls. They feel they want 100%. But for Masaka Diocese, it was taken up, and immediately the materials that were supposed to be provided by the facilities were provided in time. And this has enabled us to implement this project. We've done mentorships in both medical and management. We do training, but we also come to the facility and work with the staff through mentorship support. The total of 34 members were mentored. Those are members of the Health Unit Management Committee. And as you can see that picture, that was regular. And like you've noted, we also know how these committee members of BID are very supportive of the facility. And when this training was called upon, they all came. They are committed. They all came and were part of this engagement at the facility. Thank you so much. Through our digital learning, we have, like I said, an e-learning platform called Moodle app, and in this, 95 people have been enrolled and actually learning through this platform. And with that platform, when you pass a particular module, it automatically generates a certificate which is in your name, and it is all about U.S. medical education. This is a testimony from Sister Jennifer. I know Sister Jennifer is here from Chitasa. She's using this platform, and she has learned a lot. And actually, before coming to this diocese, she was in another diocese where we interacted with her, that is in Metiana, and she has been able to make use of this online learning platform. A number of testimonies that is about computing monthly profits, where Mary has been able to enable the facility to serve through knowing exactly how much money they make for their store. This was about a community survey. A number of presenters here have talked about what the community knows or what the community thinks is quality care. And in this, we have a training where facility staff go out in the community and do a community survey to understand exactly what the community wants, so that they design their care, putting in mind what the community wants. And this has helped this particular facility, and this is possible. They increase the number of maternity, and they are very optimistic that they can reach that demand as a month if they continue with this trend. A number of staff have been mentored, a total of 95, in medical practices, best practices, and 28 management. We are still having activities in progress before end of the year. The mentorship support will continue. Capacity building of unique members for targeted health units. In the next 2 days, by our Bishop, we are having a training of unique members in short, starting tomorrow morning, and we shall be engaging them over their roles and the guidelines of the Ministry of Health. We shall also do inline quality assessments after these mentorship engagements. We also we've secured funding for medical equipment for 6 sister-led health facilities, and these include the Irachamuri, Masunga, Hotel, Yoga, and Mirongo. They are going to get medical equipment already procured from JMS, and this equipment should be sold before close of this month. We've worked well with JMS, and we know how efficient they are, and we are sure that before close of this month, those equipment will be up and running in those facilities. And these include infant incubators, vital signs monitors, infant pregnant woman, delivery beds, electric autoclaves, and the rest. Few challenges in our work some of the recommendations we make cannot be fast-tracked because of challenges with capital, understanding in some facilities that affects implementation of the best practices that we recommend. Attitude towards learning in some facilities needs to improve, and some human members are not that supportive. So we believe that in the coming training they will be able to share ideas among themselves, but also start on the journey supporting their facilities more and do engagements with help of the health facilities. Some of the recommendations about motivation of staff. Utilize community survey reports. The staff that are sent for training should first get the knowledge. Dear in charges, when you send your staff for training, they should come Thank you very much, my Lord Bishop, we have come to the conclusion of the presentation for the day, and want to thank our partners for being with us for our journey. And ladies and gentlemen, I want to greet us. We have asked that they greet you, and I'll give them 30 seconds each with the powers vested in me by the chair of the assembly. And I want to invite my namesake, Dr. Tamari BWALA, who is the chairperson of the Diocesan. I will announce the second and Please Kakuka Tamari. I insisted on Tamari because I wanted the association. Then, yes, it is a woman. Yes.
I don't Bishop. Protocol already been introduced. The conversation here, the board, just in charge of the ministry, or the Diocesan Council. I want to thank all of you who have been work, the diocese, and the people that we have come forward to, especially the youth alcohol standards indicators that have been assigned to you by the diocese, by the assembly, and the ministry. And we are going to be advising you on your indicators, your qualities, so that we can see how you progress and bring input where we see there be some weakness. And this will guide the inspection and post-mortem depending on your performance. We don't want to go further than that. Apart from the chairman board, Vida, which is the guest of honor, you know that you are looking for leadership presence. We have people sitting here with capacity, and they are asking accommodation for interns. So that's why another area, the MP has there, I wanted to sink him in so that we can look for investment, so that we can have a leadership center here, as well as the commercial. I thank you. I want to make this opportunity to invite the guest of honor, very much appreciated also.
Yeah, I guess the water will come. Yeah, thank you very much. Dr. Kassim, however, the VHOs have asked that you speak on their behalf. You will invite, after it's spoken, we have 30 seconds, you will invite the representative of the RRDCs to also speak and say hi to the chair of the assembly. Dr. Kassim, you are most welcome. Dr. Kassim is the CTO officer of capacity. If you want, you can clap for him.
Thank you, MC. The guest of honor, my Lord, the Bishop, the Resident District Commissioner is present, the Resident State Commissioner, the Chief Administrative Officer, my colleagues, the DHOs, the government partners, health present, the medical workers, the in-charges of facilities, both in Masaka, in the diocese as a whole, our medical students. I greet you all in the name of our Lord. in its fullness. If, as health workers, this one goes to the health workers president, to the medical students, where we go to serve, do we take there? Do people get more life? Do we feel they are having life to their fullness? I think it is something that we have thought about as health workers, especially those of us who deal with the clients directly. For our facilities, the PLFPs under the network, I think it is very important with the guidance of Uganda Catholic Medical Bureau. I forgot the Executive Secretary, UCLB. So the level of care, sometimes when you visit our facilities, you may see the X, the 3, but when you go into the maybe equipment, sometimes they supersede the level of care for some of our facilities. There's something I have to appreciate Uganda Catholic Medical Bureau and my Lord Bishop. The staffing levels in our PLFP facilities are better than some other umbrella bodies, because I don't know why they are upgraded facilities, but I think for the facilities they have in Masaka, as far as the staffing requirements, they are doing much better. Some do that are even lastly, I would like to comment about management. My Lord Bishop, the guest of honor, I would like to thank the facility charges of the facilities present here for the commitment to serve. As a younger doctor, when I just finished school, when I was posted to the facility, within a few months, I was told, now you are going to be in charge. And to tell the truth, it is not an easy experience. And for some of the medical officers, the nurses present here, they train to go and serve the patients. They don't get enough dose to manage the skills. So when they get down, tell the center that when they reach there, they're told now you're in charge. So I thank the managers of these facilities for enduring. Some of them are planned on the job. So we thank them for the service. As DH also pledged to support the PLFP facilities, to have timely transfers of their PHC, non-wage, for secondment of staff. I think the hospitals have some staff seconded, but it has not happened that each of had some seconded staff to hospital. But for the lower level facilities, I think this has not been realized yet. I don't want to commit because already we have challenges also in government. And as far as staffing levels are concerned, especially with the revision of the staffing structures. But who knows? They said time will tell. We shall reach there. We shall continue to coordinate the delivery of health services and also to offer support supervision of the PLFP facilities and our umbrella as we serve humanity. Allow me now
invite the RCC, Masaka State, to come and address the
My Lord Bishop, protocol observed, because I recognize the Deputy Pope was with us here. My name is Nabakosa Josephine, the Assistant RCC, Masaka City. My Lord Bishop, I'm here to represent the RCC of Masaka City. Some of our colleagues have gone due to other responsibilities, but my brother Tinyefunza is still here with us. Without interest of time, Bishop, I will only talk about two issues. The first issue is to thank you, Masaka Diocese, for the health services given to our people. Era musikirize nebaze nnyo in a very special way. Villa and Show hospitals. For us as government, we have here Masaka Regional Referral Hospital, but again Show and Villa Bakoseka Referral Hospitals in our region. We really appreciate, on behalf of the President, on behalf of the Office of the President of Masaka City, and even the other districts around here, what we call Greater Masaka, dear Bishop, we really appreciate the services given to our people. And my second point will be a pledge to you, Bishop, that one of our major roles is to give security to the people. I want to pledge on behalf of our office that we shall always stand with you, we shall always give enough security when and wherever needed. Without interest of time, allow me, dear Bishop, to stop here. I wish you well. Masaka City is safe. May God bless you.
That's the thing about RCC. Security is secured. There is no need to say, oh, thank you very much. Yes, Father Barabbas, please give me as a and my Lord Bishop, as Father Barabbas, come and say, we introduce the gentleman who is now program manager of the HIV and BDN about. He is here as a board member of Soho City, that is now the program last year this year. Dr. Henry, over you. Yes. Father Barabbas, please invite him.
Because the bishop and the guest of honor has to hear the voice of our Lord, has to breathe.
Our dear Bishop and dear board, my name is Rwanda Masaka. We are two. He's the assistant coach in 3 and in charge of grade. For me, I'm in charge of education, sports, and others. So, both of them will get delegated here. For me, I grade on sugar, I'm a member of the board here. So, I want to request him to deliver the message of the board.
Our bishop, our chief guest, protocol observed.
think I have just two remarks. One, to thank the Catholic Church for spearheading this great noble cause of health. And in a special way to thank Masaka Diocesan Health Services Limited for organizing this very important conference for us. Uganda Kingdom, and especially His Majesty Masaka is very committed to making sure that the health of this kingdom, the people of this kingdom are healthy. And I'm sure you know what he has championed for, especially in the fight against HIV and his ruler and the women. So I think we are on the right track. So I want to thank you for inviting us, inviting Bokino, who was unable to be with us because of other engagements. But since we are also working together with him, we shall carry the message back to his office and for supporting all the efforts the church is taking and the country at large in making sure that we are healthy in all aspects, especially now using the technology as we have been taught today. Thank you so much, my Lord, and wish you well.
Thank you so much, Bokino. Before I take this honor to invite the guest, I quickly spoke to another person in the ministry. They made an effort to send someone from the ministry. Someone was on the way and they put some issues and then they sent another one. We are very, very grateful for this ministry. It shows how important you pressure, how much you pressure medical services, you pressure the efforts of the church. I think this could have invited Dr. Alex Masaka. Am I right? Who is representing the Director General of Health Services. You are welcome. And after this speech, the people will be working here to give out gifts, recognize some people who are being outstanding.
Thank you very much, Father. My Lord Bishop and the entire clergy, Masaka Diocese, the RDC, the cultural leaders around, fellow medics, ladies and gentlemen, bring to you greetings from the Ministry of Health. My name is, as I mentioned before, I'm called Dr. Alex Masaka. I'm the Assistant Commissioner in the Department of Clinical Services, and I'm in charge of hospitals and lower health facilities. And I'm standing here to represent the Director General of Health Services, Dr. Ngeresa, who is not here with us,
due to other commitments. I would like, on his behalf, I'm thanking the Catholic Diocese of Masaka, of the entire Catholic Church in this country, for that matter, because of the dedication to health. They have put in place a system, a health system, which is so resilient and it answers all the health needs of the people of this country. Thank you very much for that. You have put up health facilities, you have put up training institutions for health workers, you have extended services in various capacities, like one of my sisters here was mentioning, supplying equipment and drugs. So those services are so much valuable to us as a ministry. Where we cannot reach, you have actually reached there. Thank you very much. I would also to thank the church for the pastoral work you are doing. It is indeed very much important to us, because that is what links us with our Creator, and it aligns so many things. Because as we treat the body, you treat the soul. And that is the most important thing, because all of us will look forward to life eternal. Thank you very much. We, as a ministry, we also have this kind of meetings to review what we have been doing for the previous year and plan for the next year. Indeed, when I see you doing the same, I can see people who are focused, who know what they want to be in the future, and who know what their people should be. So, thank you for making these good plans. Reviewing improves our work. We know where our mistakes are and right strategies to improve on what we are doing. So, for this matter, the Diocese of Masaka, I think, is so modern that they are always looking for improvement all the time. And that's what is required, or what other societies do elsewhere. Always looking for better ways of doing things. We as a ministry, when we review, we make these reviews, we not only look at government facilities, but we include all the reports for every health facility. And indeed, I'm very happy to thank all those, to thank you actually as a diocese in particular, with our health workers here for participating
explained, otherwise it is not wanted. So, as you have done that, for sure, it should be for every day, not only for mothers. Because when a mother dies, it is very important. And it is equally important to know why the father has also died. So, I want to implore all health workers here and those out there who are going to attend this meeting that we should start auditing all this and make reports and present those reports to the Ministry of Health. In fact, this morning we have been discussing it with my immediate boss, and we want it to be part of our daily audits, because in this country, some people have decided to normalize the abnormals, because there is something bad. But why should it be that when an old man dies, you say it is okay, he has lived his life? We should not start uttering such words because we don't know the secret behind that. It's God's plan. But we want the God's plan to come when we have done our due diligence. And actually we have no other option but to accept that actually the Lord has called him. So, my colleague, my brother, the HO, I therefore call upon you and your colleagues to increase or to upscale the support supervision in those districts in this region. As I was there, my neighbor there was whispering to me, and indeed I had seen also similar things somewhere, that there is in the practice of irrational prescription of medicines by our clinicians, the pharmacists call it for the pharmacy. That is an act which is surely not good. If you are really a trained health worker, why should you prescribe 10 drugs for a patient? You are not only wasting medicine, but you are also damaging the liver of that patient. Instead, you are actually causing harm to that patient. So if you are not sure, you better consult. If you are unable to consult, refer that patient rather than wait and get better services. So this review here is aimed at improving service delivery such that we leave all those old practices, and currently I know those senior doctors should be giving what we call CMEs, mentoring the juniors on what to do. And it is a requirement that you have to accumulate CPD points every year. And these are some of the areas where you should be getting those points. And my brother, Dr. Katumba here, was the registrar. He knows that. If you have any doubt, you can consult him. He will tell you what to do. But these CMEs will prevent this issue of uniform pharmacy.
So there is also at times still on the same point, making wrong diagnosis. We have services in place. We have a laboratory which can help you. We have X-ray, ultrasound, those diagnostics can help you make particular diagnosis very easy if you combine with your clinical knowledge. So there is no reason of failing to make a diagnosis, and these so many drugs, maybe I will collide with the answer if I write. It's now. You give antibiotics where they are not supposed to be given, and in the end will cause antimicrobial resistance, which is a very dangerous thing that if we happen to eat it in a poor resource country like ours. So, as I told you, I'm from the Department of Medical Services. Personally, I'm an eye doctor by training, and I'm always proud to tell people that for us, eye doctors in particular, we do the work that Jesus did. Jesus will give back sight. So, I want us also to be proud to say that we are also doing the work of Jesus, you know. So, what we are, in short, I'm trying to say that let us do our work as we are supposed to do it, and everything will go well. I would like to thank in particular the hospitals, the missionary hospitals here in Masaka. We have worked together and they are doing a very good job. Tito, I know there is the Reverend Sister Dr. Rebecca. We have been working together, the fistula repair and other things. She's so hardworking. She has a colleague normally who moved together, 2 doctors. Remember? Yes, I know you are working very hard because I have reached here. So I encourage you to continue doing the same because we have a duty which is endless until the Lord calls us back to Him. We must fulfill that duty. So, okay. I think I have said everything I wanted to say. And I want again to say that the Director General Health Services, Dr. Henry Lewis, matters is not here with us, but he's actually here with you in spirit. And all the greetings from him, I would like to say, that's the message that sent me to tell you. Thank you for doing this.
Thank you very much. We are now moving into our item of the agenda. Please pass on the number and greetings to the entire Ministry of Health and the Father.
Kidogo Mobile Limited, we have Madam Manuel Jackie, has served for 20 years in diligence and passion. Above all, she is exact reason. Pennsylvania Hospital, we have Mr. Yakia Emmanuel, taking care of the gardens in the training school, has worked for 20 years, serving with commitment and working disciplined and trustworthy. That's very important. Lower left, Kidong Hospital, we have Mr. Kisa Francis Kironde, the driver. He has been with us for 32 years. He exhibited commitment, stability, dedication, and defensive driving. Still Kidong Hospital, these are not employees of the hospital, but have worked over and asked for more. Mr. Wabengwa Testa, we thank him for his contribution to the growth of our Virgin Mary. Sister Testa is not here. Who is going to deliver it? This is another Testa. We want to appreciate Ministry of Health by giving an award to Dr. Asenwa for the provision of PHC funds and intern doctors. Dr. Asenwa, we also want to recognize the manager Stanley Bank for the donation of an Anesthesia machine. And those who are not in medicine, anesthesia is a machine that makes you silent. This is good. We have lower level units. St. Vincent Kayani, the Health Center 2. We have the Western Nurse has worked with us for 11 years. Madam Owen a registered nurse. This is a hard to reach area. Even when you go to the facility, he has that smile. Thank you. Now we will talk with you. Lower level unit, St. Bernard's Mania, President 3. We have a medical clinic officer, is the in charge, Mr. Jesua Vincent. He has stayed with us for 10 years. It used to be a hard to reach area, but now Manya's changed. Everybody is learning to go to Manya because of the new services. Thank you, Mr. Cheswa, and to serve that full gift. And the envelope that wraps up gifts goes to Father Semogene for being the MC. I received it here. Bishop is giving us the concluding remarks. We pray to find grace.
Good evening, everybody. I would like to appreciate you for the resilience. You have endured, absorbed so many presentations, and I know your grades are now processing the take home. On your behalf, I once again thank our guest of honor, the talents. Thank you for stepping in for the Director General, Dr. Marisa, and stepping in that effectively. I want to thank all of you who have made presentations. They have been very enriching, you have made them very lively. It has been a long day, but I think everybody is happy with what has happened. I thank all who have given remarks, the assistant RCC, and how the other PCs and RCCs, DHO, Dr. Masaka, for all the DHOs, Dr. and chairperson of our organization, Dr. Matuka, for representing all of you, the chairman of all of governors, and units, management focus. Our partners, what do I have to add? I just want to ask you to keep steering the boat with us. Our pledge is continued commitment to serving everybody, especially the underprivileged. Lastly, the food soldiers, health workers. The health workers were the food soldiers. You know every detail, you have gone and you have been on the front line, and we urge you to continue pushing forward, never settle, because the people you serve still need you, we still need you, so all of us, and we need you badly. Our patron, Uganda Catholic Medical Bureau, we thank you for that wonderful patronage. Every time we call upon you, you are available, and we will bring in new ideas. I think your presentation today has been very, very inspiring. Extremely inspiring. I wanted to recognize our team, the management at the Health Medical Services Headquarters, Togo, led by Father Tawasi. Thank you for organizing this step every year. Who's calling amazing. Oh, you are our future. We are sure we have continuity. You are assuring us of accountability in terms of committed health workers. You know, the training you are undergoing will ensure that you get the qualities. You already exhibit them. Dr. Raj has employed my daughter, Lawrence, Valencia Neswa, and I'm proud that to give good comments about her. She's good. I'm very grateful. God is love. This fall, we pray that our health services providers may go out, continue to take advantage, positive advantage of technological advances to serve your people better. We make this prayer through Christ our Lord. The Lord be with you. And may Almighty God bless you, the Father, and the Son, and the Holy Spirit. Safe journey home.